We can think of psychiatric care being delivered in a spectrum, meaning from least intensive amount of services in terms of supervision and time intensity to the most intensive. So what would be the most intensive? The most intensive would be someone who is hospitalized. So someone who's so ill, who's so sick that they require continuous 24/7 supervision while working on a really intensive plan and maybe doing some evaluations there. And so outpatient treatment is perhaps the less intensive of those, meaning that it doesn't typically take you outside of your day-to-day life. So you're probably going to bed, or your child is going to bed in their own home. They're missing some school to go to one individual appointment, but they're not missing weeks on end or several days in a row in order to do that. And so outpatient setting is probably the most common way that child and adolescent psychiatrists practice in the US. All right, using that analogy of the spectrum of psychiatric care, and we're going to move up in intensity, the next level may be something like what we call community mental health care. So that would often be services that often are subsidized by local taxpayers too, that usually include a number of things. So not only a child and adolescent psychiatrist might be part of it, but typically it also involves maybe case management services or social work services or therapy services as well, all integrated together, meant to work as a whole. And so there are some kids who benefit from maybe more intensive services. Now that's not to say that in the outpatient model you can't also get individual therapy or maybe some other social work services, but those things tend to be special features of a particular clinic. Whereas community mental health, the model is built around having this integrated structure working with kids. The other thing that I put in this middle section in terms of intensity of care might be programs that are specialized, that are geared to help kids and actually may require a little bit more intensive time than you might see in an outpatient setting. Okay, so for this, I'd like you to think about a couple of things. So I might take a diagnosis like obsessive compulsive disorder, right? Where someone is so obsessed, their mind keeps ruminating and going round and round over particular things, or they're unable to really break free from certain habits that are keeping them tied down, that are really restricting their world and restricting their life to a very narrow thing and keeping them from making it to school or establishing really great relationships. Okay, some kids and some adolescents and some adults might be struggling to such a degree that maybe they might benefit from an intensive program that just focuses on treating OCD. And so there are specialty clinics where someone might go and spend, say, a week or 3 to 5 days doing just really intensive work around that particular diagnosis. And so child psychiatrists also work there in these places where maybe they focus in on the particular diagnosis that they are most excited about and most interested in treating, and so they can spend time just continuing to perfect and craft that while working with some of the most intense features of the disorder from people who are coming from all around. Similarly, there are things called partial day hospitalization programs or intensive outpatient programs too, which also fit in this middle tier in terms of intensity, because they often require families or kids to spend more time outside of the home in order to get that type of care. Again, that care can be really broad too and apply to a lot of kids who may be struggling with various different things, including anxiety or depression. And so that is another way in which child psychiatrists practice. And again, in ascending order, last but certainly not least, is hospitalization, so working on an inpatient unit. And that might come in a variety of ways, because there are private hospitals and nonprofit hospitals, there are state-run facilities as well. And so the way that looks can look very different, but there are many child psychiatrists who feel called to focus on really meeting families and meeting kids when they're at that crisis point. And so when they're requiring hospitalizations to keep them safe or to work on a really early intensive plan to help them get back and reintegrate it to their community, to their school, to their family, this is a really great place to do some tremendous work in that arena.